How can I help you tonight? Ma'am.
I'm pregnant and want to know who the father is. Also, the baby's skin color.
Good evening. I am Left, an X-ray tech from Texas. Tonight, I will tell you the unbelievable episodes of my coworker, ultrasound tech Lisa. Lisa started as an X-ray tech 21 years ago. But during one of her portable exams, she lifted an obese patient and hurt her back. She then moved on to mammography and sonography as her specialties. She works the same shift as me, Saturdays and Sundays, overnight. Unlike X-rays and CT, sonograms, or ultrasonography, do not use X-rays. So pregnant women and babies are not exposed to radiation. So, in the emergency room, ultrasounds are ordered for patients who suspect an ectopic pregnancy or miscarriage. However, in reality, ERs are used freely by uninsured women who can be pregnant. Many such patients come to the ER to find out if they are pregnant. They come to the ER when their period is 3 days late and think they might be pregnant. Then, the emergency physician orders a transvaginal ultrasound exam. This test is done by inserting a probe into the vagina to examine the uterus and ovaries. Lay the patient face up. Cover the lower body with a sheet. The tech passes the probe under the sheet, asking her to insert it into her vagina like a tampon. In addition, there is a pelvic ultrasound exam, which scans from the top of the abdomen. Transvaginal ultrasound is more effective because the vagina is closer to the uterus than the pelvis. Lisa is a woman, so there is no problem for a female technologist to perform a transvaginal ultrasound on a female patient. I am sometimes asked to chaperone when a male sonographer is in charge. Now, back to the patient who wants a pregnancy test. Usually, if you think you are pregnant, you can use a pregnancy test kit sold at drugstores. Some do it, and some don't. Lisa doesn't understand why they won't buy a test kit and test for themselves. Pregnancy test kits are also sold in dollar stores now. Lisa says,
"Since the ER is an emergency, I don't know how a patient can get a doctor to order an ultrasound, depending on whether they are pregnant. If they have a pain or bleeding at least, then we can exam with ultrasound for emergency."
Now, when a woman who found out she was pregnant with a drugstore pregnancy kit comes in, the conversation between the patient and Lisa goes something like this.
"How can I help you?"
I used a pregnancy kit, and it was positive.
"So, what would you like to know?"
I want to know if it's male or female.
Patients who come to the ER to find out the gender of the fetus, even though they have just become pregnant. Such patients are prevalent in the ER. And since Lisa isn't a medical doctor, she's not allowed to discuss the images. According to Lisa, a sonogram can reveal the penis around 16 weeks of pregnancy if you are lucky. If the fetus is female, the genitals will not appear on the screen. During the examination, Lisa is bombarded with questions and has to remain silent. Some patients come to the ER every week, starting with the discovery of pregnancy. However, one day someone advises them to go to the obstetrics and gynecology department, so they stop coming to the ER and can give birth. Someone is probably a social worker. It would be great if they could give birth in a hospital, but some women want an abortion. Texas is a state where abortions are prohibited for any reason. I was in favor of abortion. Lisa used to be too. But hearing about Lisa's experiences, it'll change your mind too. One of Lisa's patients had 11 abortions. This patient's story made Lisa sick. Lisa wants to know why didn't she use birth control. Another patient leaves Texas for Louisiana or Mexico to have surgery and return. As you all know, post-operative follow-up is necessary after surgery. The doctor must check whether there are any complications, infections, or side effects of the medicine and whether the patient is recovering healthily. But women know it is challenging to drive the long way again to follow up. We don't know how many women who had a good recovery or not. There will be no record on their local medical records unless they reveal it. Besides, no doctor wants to follow up with someone who has had surgery at another hospital because they don't want to be responsible. Therefore, when those women have a problem, they use the emergency room. Lisa examines one such patient. The patient had an abortion when she was 7 months pregnant. A scan revealed that she still had fragments of her fetus in her uterus. Let's go back to the patient at the beginning of this video. This patient came to the ER recently. She is 17 years old. She knew she was pregnant. This woman went to a striptease with her boyfriend, and she took her boyfriend and a male dancer to her house and they did a threesome. She got pregnant around that time. So she wanted to know who the fetus's father was and the fetus's skin color. Lisa says,
When you don't know who the father is, you don't know who to ask for help.
This patient's diagnosis is the doctor's responsibility, but what will the doctor tell her? For the same reason, some women bring their boyfriends to the ER to prove their pregnancy wasn't fake. Her pregnancy must be true. However, what would the father of the fetus think her pregnancy is revealed longer than their dating period? I cannot give my opinion to these people, but whenever I hear these episodes, I wonder what education is for. And I think I understand why Republicans are so desperately against abortion. If abortion is legalized, the thought of killing more 7-month-old fetti would be unbearable. Sexual intercourse can lead to pregnancy, so if you don't want to get pregnant, don't forget to use contraception. I am sure sexual intercourse is an entertainment driven by the hormone to some men. I'll bet God would never expect this gift could be so popular and carried out in human world. Thank you for viewing. If you like this video, subscribe to my channel. Please also hit the like button and leave a comment.